Did you know that before birth, every baby has a special blood vessel in their heart that's supposed to close shortly after they're born? But what happens if it doesn't? This condition is called patent ductus arteriosus, or PDA, and today, we're going to break it down in a simple and easy to understand way. What is PDA? Before a baby is born, their lungs are not yet in use. So the body uses a temporary blood vessel called the ductus arteriosus to bypass the lungs. This vessel connects two major arteries, the aorta and the pulmonary artery. After birth, when the baby starts breathing, this vessel is supposed to close within the first few days of life. But in some babies, it stays open, or patent. This is what we call patent ductus arteriosus. When it remains open, oxygen-rich blood from the aorta flows back into the pulmonary artery, causing extra blood to go to the lungs. Why is PDA a problem? This extra blood flow can make the heart and lungs work harder than normal. Over time, if untreated, it can lead to complications such as breathing difficulties, poor growth in infants, increased risk of infections, and in severe cases, heart failure. However, the impact depends on how large the PDA is. Causes and risk factors. PDA is a type of congenital heart disease, meaning it is present at birth. It is more common in premature babies, babies with low birth weight, and sometimes due to genetic or environmental factors. In many cases, the exact cause is unknown. Symptoms vary depending on the size of the PDA. Small PDAs may cause no symptoms at all and might only be detected during a routine checkup. Larger PDAs can cause fast or heavy breathing, sweating, especially during feeding, poor weight gain, fatigue, frequent lung infections. Doctors may also hear a characteristic heart murmur. Diagnosis. Doctors often first suspect PDA after hearing a heart murmur. To confirm the diagnosis, they use an echocardiogram, which uses sound waves to create images of the heart. This test helps doctors see the open duct and measure how much blood is flowing through it. Other tests may include chest X-rays or an ECG to assess heart function. Treatment depends on the size of the PDA and the symptoms. For small PDAs, doctors may simply monitor the condition, as it can close on its own over time. For premature babies, medications can sometimes help close the ductus arteriosus. For larger or persistent PDAs, doctors may recommend closing the opening using a catheter-based procedure, where a small device is inserted through a blood vessel to seal the duct. In some cases, surgery may be required to close it. The good news is that with early diagnosis and proper treatment, most children with patent ductus arteriosus grow up to live healthy, normal lives. Understanding these conditions can help save lives through early detection and care.